¿Alguien se anima?
Oh, by the way, if you want to contact me, all my contact information is here.
That picture from Mythbuster?
No, that's no. We just have a yearly picture that we take. That's from Stanford. We have our dog. She's very small. You can barely see her. I'm holding our dog mascot. Okay. No questions? Okay.
Yeah, we have one.
Hello. Good morning. I think your presentation was very interesting. And I want to I agree a lot with you say that connectivity, the social capital is very important for the society, and the connectivity between the people, it's important in social care, in healthcare. But we have a problem here. We have a problem that the main of our patients are, you can say, old people. And for old people, new technologies now, today, in our times, is not easy to use. And so I have a question: how to connect to the kind of people that don't use internet, don't use new technologies. And another thing I want to share to you that I think this pain in our health system is quite different to U.S. system. And here the public system is the main one, and we have limited resources. So we can't use all we want for each patient. So we have to control, and you have to use the resource we have for all the patients we have. So it's not very easy. I mean, doing all the things you say, because maybe we need a lot of resource. And also, we have to, because you speak about a lot. You speak a lot about devices and a lot of research. And my comment is about that. So many devices is a big consume. It's not ecological toll. It's not sustainable. And another problem, the access to that kind of devices is for those people that can pay for them. But the people who can't pay for them, they can't access to that devices. So we have to the challenge to try to translate your ideas into another kind of tools, not so technological, but because the self-tracking is very interesting, I think, but we can't think about use this self-tracking with very special devices. I think that the case of the children, of the child was interesting for a lot of patients, but I mean, using so many technology, maybe, I mean, the idea is good. I like the idea, but for us, the challenge is try to use the idea in a more simple way, because our researchers are very limited, and we have the responsibility of using our research for all the people we have to attend. So my main question is how to connect, to use connectivity with the people, the old people, for example, that are not used to using communication, social medias, and all those things.
Well, that's a great question, and I'll give you an answer from my real life. So I also do clinical research, and I've been using self-tracking of my patients in my clinical studies for over 6 or 7 years. I have never used a smartphone. I've never used a sensor. I have never used SMS texting for my self-tracking. What I use in my study is a pen and a piece of paper, and I send my patients home with a diary, because what I do is pain research, and so I'm interested in knowing how the medications that we're studying affect people's pain on a daily basis. So you can do self-tracking, and I've done years of self-tracking without any fancy devices. We use written diaries. We communicate by telephone. So we call our patients on the phone. In my case, for my studies, we call them every day. But I understand your concern about limited resources, and so in medicine we're not able to do everything. I certainly didn't want to give an idea that well, that all these devices are necessary. I don't think that they are necessary. But what I do see is the creation of a lot of devices. And what I do see is a lot of interest from consumers in the United States to buy them. So the reason I presented it was to say there's an opportunity, if the devices are being purchased and the data is being collected, for us to study it. But I absolutely do not think it's essential. I think, and I know that because in my own practice, it's only this year that I'm starting to incorporate smartphones into my research. We're working with a company called Ginger.io to try to do self-tracking and surveys through smartphones. But we haven't implemented any of that yet, and I've done it all with pen and paper. So it can be quite effective. But, it is resource intensive, which is why I also mentioned the value of peer-to-peer healthcare. There was a question before from someone in the audience about, well, as physicians, how do we find time to do social media? How do we find time to do social networking in our busy schedules? And I would turn that around and say, how can we create social capital so that our patients can better manage their diseases within their own families and their communities? Because they only see me once a year or once a month. But if we can help our patients build social capital that way, we don't have to worry about whether we have time for social media, but can we help our patients learn how to use it? I think that's one of the things. And then, of course, you will have patients who don't understand social media or how to use it. You have to find other resources for them. But, again, like I said, we stick to the basics. Telephone. Yes.
¿Alguna otra pregunta más?
Hello. Yes. Hello. Good morning. Can you hear me? Yes.
Yes.
Yes. Okay. It's well. First of all, thank you for your presentation. I think it has been very interesting for us. Let me introduce briefly myself because I'm a professor here in Deusto Business School, and we are studying implementation issues related to information technologies. And one of the main challenges we see when implementing information technology, of course, is resistance from the users or from in your case, I suppose from physicians or healthcare people. But then I'd like to know what has been your experience from this perspective in your hospital or your research center. And I also interested in your feedback about not only about people, but also about processes, new structure and new skills required for your people in your hospital. If you, for example, have recruited new kind of profile for doing big data, for example, big data, doing big data or business analytics, it's a new or more complex process than traditional research methods. And then I'm interested if you in your hospital have introduced new roles or new skills from this perspective, which I think in Spain, one of the big problems is that implementing this technology could require changes in the business models of the healthcare processes. And in that sense, we should work more on changing the way we do things using these technologies. And this could be a big challenge from a system based on public service. It's a reflection also related with the question.
Okay, no, I think that's a great question. So what I understood from it, you have some questions about how you implement IT into an existing organization, and what are the challenges with deploying new technologies. And I do think that that's something universal. Everyone has to face these challenges. I think one of the things that we're seeing is that organizations in the United States, but I can only speak for my hospital, my medical school, is that we're living in an environment where people are starting to bring their smartphones into work. They're bringing their iPads into work. It's, some people call it the consumerization of IT, in the sense that, we're having to deal with user-centric models of information technology. And Stanford was very resistive at first to how do we support someone else's device that they're bringing into our networks? What are the security implications? But we very quickly realized that that's where we're going. People want a personalized experience when it comes to information technology. I think we were one of the first medical schools to provide iPads to our medical students. Again, I think initially it was done out of a concern for being green and avoiding printing a lot of paper. But obviously there is a potential for personalization of information and how you access it. That said, there's some stuff that really sucks and that's not good. And certainly electronic medical records are not perfect. I think one thing that organizations need to think about is user-centered design thinking, where we really need to very early on incorporate feedback from physicians into the system. We have changed vendors. We went from we had at least 3 electronic health records in the time that I've been at Stanford. We're now transitioning away from Cerner. We actually have 2 hospitals, Packard Children's Hospital and Stanford University Hospital. They're connected. I work at both. But when I go from Stanford to Lucille Packard, I have to go from Epic to Cerner. And the systems don't talk to each other. So, these things are changing. In the United States, of course, we have meaningful use incentives that the government is making for hospitals to change over to electronic health records. There's events like Datapalooza in Washington, D.C. The participation has skyrocketed from maybe 250 people 2 years ago to 1,500 people now, all looking at ways we can improve the interchange of data among medical health records, way we can improve things. But it's a slow process. I don't know that I have an easy solution. And it involves, obviously, a lot of work to educate your physicians and the people who are using the system, and constant process improvement to get feedback and improve. It's what it is. That's the hard work of it. I wish I had an easy solution for you.
Una última pregunta antes de pasar a la siguiente sesión.
Hello. Hello. Okay. First of all, thank you for a very comprehensive presentation. Continuing to Professor's question regarding the resistance of physicians against the implementation of new technologies, have you ever reflected that people usually are afraid to implement, to accept new technologies because of this fear of unemployment? For example, if we talk about the social, about networking, I see a kind of risk for physicians from the side of offering advices and self-curing. Don't you consider this as a risk, as an unemployment risk, as a risk that people won't get diseases anymore, so they'll get healthier?
If people are so healthy they don't get sick, then that's fine. I'd rather be out of work. But I do think, the model that we're moving towards is not at one extreme or the other extreme. It's not a model of healthcare. The model of healthcare that I would like us to see moving towards is not one where patients heal themselves without any physicians, and it's not the current model of paternalistic medicine where I'm your doctor, I'm going to tell you what you need to do, I know best, and you need to follow what I have to say. I think what we're looking for is a middle ground where physicians can work together with patients and, of course, their families to leverage the best of both worlds. I'll ask you a question, why can't a patient and their caregiver who suffer from a disease like Crohn's, why can't they be the expert about Emily? I'm not the expert about Emily. Emily's mom, who's there in the middle of the night when she's having her problems, is the expert about Emily. So why can't we work together as equals who are experts in different things to try to find a solution? So that would be my answer. I think I don't see it as one or the other. I see it as a partnership.
One last question about self-tracking. Is there any research regarding the accessibility of customers, generally, to these kind of devices of self-tracking? For normal worker or unemployed people or people that,
Okay, great question. Who is using self-tracking? Who are self-trackers? So I think the data point that I hear a lot is the data from the Pew Internet American Life Project. They just asked, a side question in their 2010 survey. It wasn't really a full set of questions on use of self-tracking, but in 2010, what they saw was that 27% of American adults greater than 18 were tracking their health information online. And that was in 2010. So one of the things that is very interesting is in 2012, Susanna Fox and the Pew Internet American Life Project are going back into the field in August and September of this year to conduct more field research on self-tracking. Who's doing it? What the implications of that are? How are they doing self-tracking? And I'm really looking forward to that because Susanna is going to be the open keynote at Medicine X, and what she's going to be talking about is presenting that new data that she's going to be getting in August and September, or so I understand. My understanding is that she's going to talk about that new data. So we should have new data soon. But again, self-tracking is very new. And as I mentioned in my talk, is it entertainment or is it science? I think that's under our control. We have a say in the future of it. And it's going to be studies like the Pew Internet American Life Project, and it's going to be collaborations with us as healthcare providers that maybe can shape it into something that's meaningful.
Pues vamos a darle las gracias y pasar a la siguiente sesión.
Thank you.